Welcome back to the Deep Dive. It is Sunday, February 8th, 2026. Now, you might know this if you're the kind of person who really follows, the calendar for specific observances, or maybe you follow proclamations out of Governor Whitmer's office in Michigan. But today is the start of National Salute to Veteran Patients Week.
Which is, a bit of a mouthful of a title. And usually this week is for, the ceremonial stuff, people visiting VA hospitals, volunteering.
Handing out Valentines, that kind of thing.
Exactly. And don't get me wrong, that recognition is incredibly important for morale. It's huge.
Absolutely.
Yeah.
But given the absolute stack of documents we have on the desk today, it is a heavy stack. We thought we'd do something a little different, sort of a State of the Union on veteran support.
Right. Because the reality for a veteran in 2026, it isn't really defined by a parade once a year. It's defined by the hard data, by legislation that is literally hitting the ground as we speak, and by some pretty massive logistical shifts.
We're not just reading headlines today. We're looking at the whole ecosystem. So lay out the sources for us. What are we working with?
Okay, so we've pulled together a pretty comprehensive picture. First, and this is the big one, we have the 2023 National Veteran Suicide Prevention Annual Report.
And I know it says 2023, but this is brand new data, right?
Just released. The VA put it out 3 days ago, February 5th, 2026. It's the most current sort of autopsy of the situation we have.
And to pair with that, we have the actual text of the Senator Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act.
Yep, and a specific section that really changes the economics of home care. Plus some breaking news on a huge hiring blitz at the VA and some really interesting stuff from nonprofits.
So the mission today is to connect all these dots, to move from the clinical side all the way to the pilots flying veterans to treatment on their own dime. So let's unpack this.
We have to start with the heaviest document here. The 2023 Suicide Prevention Report. And like we said, government data lags, so even though we're in 2026, we're looking at the final numbers for 2023. What are we seeing?
Well, looking at the executive summary, if you just look at the raw count, the headline number, there is a tiny bit of good news. The total number of veteran suicides in 2023 was 6,398, which is a decrease from the year before.
Okay, so 44 fewer deaths. That sounds like progress. And we should never, ever dismiss lives saved. However, and this is where we have to be really careful with statistics, while the count went down, the rate actually went up.
Wait, hold on. How does the total number go down, but the rate per person go up? That sounds contradictory.
It's a denominator issue. You have to remember the demographic shift that's happening. The total population of veterans in the U.S. is shrinking pretty rapidly, actually, as the older generations, Korea, Vietnam, pass away. So the pool of veterans is getting smaller.
I see. So even with fewer suicides, because the group itself is smaller, the percentage ticks up.
Precisely. The rate per 100,000 veterans rose slightly. For men, it went from 37.3 to 37.8. For women, from 13.7 to 13.9. So the individual risk hasn't actually improved. The community is just contracting.
That is a crucial distinction. It means we can't just high-five over the lower total. We have to look at what's driving this rate. And this report, it relies on something called the Behavioral Health Autopsy Program. That sounds intense.
It is intense, but it's not a physical autopsy. It's a deep data review of the veteran's life leading up to the event. Medical records, interviews, and it highlights a risk factor that I think gets completely overlooked in the, mainstream conversation about mental health.
What's that?
Physical pain.
Pain. Usually when we talk about this, you hear about PTSD, anxiety, depression. Not physical pain is the primary driver.
Right, because we tend to separate mental and physical health into two different buckets. You have your therapist and you have your orthopedist. But the data says that's a mistake. When they looked at veterans who died by suicide, the most frequently identified risk factor present in 55.9% of cases was pain.
That is staggering. More than half.
It is. It beat out sleep problems, which was at 51.7%. It beat out relationship issues. So when we talk about suicide prevention, if we are only talking about therapy, we are missing half the picture. This data screams that suicide prevention is pain management.
That really reframes the issue. It's not just, are you sad? It's, does your body hurt so much that you can't imagine living another day?
Exactly. It's the exhaustion. And there's another factor the report highlights, which is the how, the method. Firearms were involved in 72.2% of veteran suicides in 2023.
How does that compare to the civilian population? Is there a big gap?
Huge gap. For non-veteran adults, it's 52.2%. That's a 20-point difference. And the report makes a very specific point about, lethal means safety. It
Yeah.
mentions that almost 29% of these cases involved unsecured firearms.
So we have the why, often pain and sleep, and the how access to firearms. But the report also uses this phrase, anchors of hope. That implies something is working.
There is. And this is the most critical takeaway for anyone listening. The data shows that veterans who are engaged in VHA care, they just have better outcomes. In fact, 61% of the veterans who died by suicide in 2023 were not getting VHA healthcare in their final year.
61%.
Yeah.
The clear majority.
Yes. So the report explicitly calls for a whole-of-nation approach because the VA simply isn't reaching everyone. If you're in the system, you have a safety net. It's imperfect, but it's there. If you're outside the system, your risk profile is significantly higher.
That statistic really bridges the gap to our next topic. If the goal is keeping veterans alive, we have to keep them connected to care. And often the best place for that care is at home.
Right. Which brings us to the Senator Elizabeth Dole Act.
The Dole Act. This was signed fairly recently, but we're seeing the implementation roll out right now in early 2026.
Yes, specifically Section 120. It technically went effective back in September of 2025, but the VA has been pushing out guidance and press releases about it just this week. This is a game changer for veterans with very complex, very high-cost needs.
Okay, so break it down for us. What was the problem before Section 120?
So, historically, the VA has this rule about paying for non-institutional care, basically home care. They capped the payment at 65% of what it would cost to put you in a nursing home.
Okay, so if a nursing home costs, let's say, $10,000 a month, the VA would only pay $6,500 for you to stay at home.
Roughly, yes. The logic was cost containment. But think about the reality. If you're a veteran on a ventilator or you have ALS, your home care costs, they aren't cheap. That often exceeded that 65% cap.
So because of a math formula, you'd be forced to leave your home and go into a facility, even if you didn't want to.
Exactly. It caused what they call care disruption, which is a polite way of saying it ripped families apart. But Section 120 changes that math. As of right now, that cap is raised to 100% of the nursing home rate.
So they'll match it dollar for dollar.
Yes. And here is where it gets really interesting. For specific conditions, ALS, spinal cord injuries, things like that, the VA can now exceed that 100% cap if it's clinically necessary.
Wow. So there's no arbitrary ceiling forcing them out anymore.
That's the idea. Now, the VA estimates this will affect about 200 veterans per fiscal year.
That doesn't sound like a huge number.
It's not a huge volume number, no. But the impact per person is infinite. For those 200 families, this is everything. It means a veteran can stay in their living room surrounded by family instead of a clinical ward. It's a huge shift in the philosophy of care.
And that links right back to the suicide report, doesn't it? If isolation and pain are drivers, staying home seems like a pretty powerful antidote.
Absolutely. It keeps the support system intact.
Okay, let's shift gears a little bit. We've talked health and home. Let's talk about purpose, employment, because that's another huge factor in mental health.
And this is a very recent development. On February 3rd, just 5 days ago, the VA announced a major hiring push. They're looking for over 300 vocational rehabilitation counselors.
VRCs. And explain the difference here. This isn't just a career center. This is the VR&E program.
Correct. Veteran readiness and employment. It's separate from the GI Bill. This is specifically for veterans with service-connected disabilities. A VRC's job is to help that veteran figure out, okay, my body or my mind has changed. I can't do what I used to do. What's next?
So it's career counseling, but with a heavy medical and psychological component.
Exactly. It could be retraining, it could be finding an adapted job, or it could be independent living services for those who can't return to work yet.
And I noticed in the notes you actually dug up the qualification standard for this. You went full nerd on VA Handbook 500-5157. Why?
I did because the devil is always in the hiring standards. The headline is VA is hiring, but the nuance is who they're willing to hire.
What did you find?
Well, it's a high bar. You need a master's degree in rehabilitation counseling or a related field. But there was a revision to the standards that's pretty telling.
Oh.
Previously, you needed a supervised internship during your degree. But the new standard allows for 1 year of postmaster's professional experience to substitute for that internship.
That's interesting. So if you've been working as a counselor for a year, you can now apply even if your degree program didn't check that specific box.
Exactly. It widens the applicant pool significantly. And they need to fill 300 spots fast. The application window closes March 17th. They need that flexibility.
And why this specific role? Why emphasize 300 counselors right now?
Because of integration. If a veteran leaves the service and loses that sense of mission, they're vulnerable. We saw the stats: isolation, lack of purpose. These are killers. These counselors are the ones who help build a new mission.
So we have the data on the risks. We have legislation for the home. We have counselors for the future. But there's still a gap, isn't there?
There's always a gap, the last mile problem. You can have the best hospital, the best counselor, but if the veteran can't get there, it doesn't matter.
And this is where the private sector steps in. I was reading about a program called Angel Wings for Veterans. I had no idea this existed.
It's phenomenal. It's part of a nonprofit called Mercy Medical Angels. Basically, they provide free transportation for veterans. And we're not just talking a bus voucher. We're talking private pilots.
Private pilots, like someone with a Cessna.
Yes, volunteer pilots who fly their own small aircraft. And get this, they often cover the cost of fuel themselves. They are donating the flight.
That is incredible. And where are they taking these veterans? Just to surgery?
No, and this is the key. They fly them to clinical appointments, sure, but also to healing retreats, service dog training camps, and adaptive sports events.
See, that connects back to the holistic view. A healing retreat or picking up a service dog that isn't strictly medical, so the VA might not pay for the travel.
Exactly. The VA can pay for the doctor, but they have strict rules. They usually can't fly you to a retreat in Montana. Angel Wings does that.
And what's the eligibility?
It's based on financial need, and the veteran have to be able to board the plane. But it's a perfect example of that mesh we talk about. The government builds the hospital, the community builds the road to get there.
Speaking of community gestures, we have to mention something a little lighter, since Valentine's Day is next week.
Yes, the Texas Veterans Land Board is running their Valentine's for Vets campaign.
I love this. It's simple, right? Just send a card.
It is simple, but the logistics are impressive. They have 10 Texas state veterans homes, places like the Easery Roan home in Amarillo, and they are asking the public to just flood these homes with cards.
Is there a deadline on that?
Yes, they need to be postmarked by Tuesday, February 10th. So if you're listening to this on release day, get your stamps ready.
We'll put the addresses in the show notes, but is this just fluff? Does a card actually matter when we're talking about suicide rates and home care caps?
I think it does. Think back to the suicide report, isolation.
It's a major risk factor.
Exactly. Residents in these homes can feel incredibly cut off. A card from a stranger, a school kid, it disrupts that isolation. It's a signal you are not forgotten.
We are the land of the free because of the brave.
That's what Commissioner Don Buckingham said. It's a slogan, sure, but the act of writing the card makes it real. In the context of mental health, connection is currency.
So we've covered a lot of ground. We have a tragedy driven by pain and isolation. We have new law keeping the sickest veterans at home. We have counselors providing purpose. And pilots and Valentines fill in the cracks.
It's that whole-of-nation approach, to use the VA's own language.
So what does this all mean for us, for the listener?
I think it means we have to stop looking for a silver bullet. There isn't one law or one pill that fixes this. It's a mesh.
A mesh?
Yes. The Dole Act is a strong steel thread. The suicide report shows where the mesh is tearing, like with unsecured firearms or chronic pain. The VR&E counselors are weaving in career support, and organizations like Mercy Medical Angels are patching the holes.
It's impressive how many moving parts there are. It's not just the VA.
It is. But I want to leave you with a provocative thought.
Okay, hit me.
We said that 61% of the veterans who died by suicide were not in VHA care. We know the resources are there. The crisis line, 988, press 1. The hospitals. The new home care caps. Free flights.
But the majority aren't using them.
Exactly. The infrastructure is massive. The funding is there. The desire to help is there. Yet the connection is missing. The question isn't, do we have the resources? The question is, why is the bridge to those resources still so difficult for so many to cross?
That is the question we need to keep asking. Because until that bridge is easy to cross, the infrastructure doesn't matter.
Precisely.
Thank you for listening to this deep dive. Whether you send a Valentine, apply for a counseling job, or just check in on a veteran friend today, you are part of that mesh.
Take care.
We'll see you next time.